Our program is a community-based program because we're located here in Longview, Texas, here at CHRISTUS Good Shepherd Hospital in Longview, part of the CHRISTUS system, but we have our academic affiliation and are sponsored by the University of Texas Health Science Center in Tyler, Texas. You're primarily doing face-to-face patient care. We believe in graduated responsibility, so you'll start off with less of a patient load in the beginning of the year and graduate to a more full patient load, and that's both in the ICU, in inpatient wards, or in the outpatient clinics. And you are the doctor. Once you graduate from medical school, you have MD, and this is the extra training so that you can actually be a doctor unsupervised after 3 years taking care of your own patients.
Our residency program, CHRISTUS Good Shepherd Internal Medicine in Longview, has a very unique ability to give you excellent experience in the type of cases and the type of conditions that you need to be an expert at and know like the back of your hand, that you will be treating every day. But we also have exposure and education in a lot of those rarer and more complex conditions that you may not get to see on a day-to-day basis, but you will feel more than comfortable evaluating and diagnosing and treating in the future. We've got excellent education, we've got excellent patient care, we've got excellent preparation for whatever type of practice that these candidates and these residents want to pursue when they graduate residency.
The best part of this residency program is that it's resident-driven. So there's no specific pathway that you need to follow. Our goal is for the residents to be the best physicians that they can be. So if they want to be a primary care physician, they want to be a hospitalist, they want to be a specialist, we gear their rotations so that they can take advantage of all the opportunities here so they can get to their goal and be the best physician they can be.
That academics absolutely is a strength of the program. At the same time, I think that the ability of the faculty to teach and relate with the residents and the true, genuine desire to make sure our residents are successful in their career really sets us apart from a lot of other residency programs.
We have dedicated faculty. So you are not just working with internal medicine specialists, but also you're going to work with subspecialists such as oncologists, gastroenterologists, cardiologists, just to mention a few. The program provides a lot of good education, good patient care. I'm glad that we're the only residency program here because there's no competition with other residents for cases, and they let us manage patients actively instead of being just in the background.
Life in East Texas, I think, is great. I think that here in Longview, we get the best of both worlds. We've got major metropolitan areas, an hour and a half, 2 hours to the west. We've got Shreveport to the east, but we still have that small town feel where we're not having to fight against traffic at 5 o'clock every day. We're able to get really anywhere in Longview within 15 or 20 minutes. And it's an excellent place for a family.
I'm an outsider, so I felt when I came in, everybody welcomed me and everybody mentored me. So I felt like I was part of the family, and the family that nurtures the interests and skills of the family members. So I stayed here because I love the program, I love the area.
We are happy that we went into this partnership 9-10 years ago because we saw the potential here at Good Shepherd. And there's no doubt in my mind that this program will continue to grow because Good Shepherd really has a lot to offer to all of us and to our community.
Even though we're a community-based program with a university affiliation, we've won a lot of awards. We have a commitment to quality improvement and research, and at the most recent Texas American College of Physicians state meeting in San Antonio, our residents walked away with first place in quality improvement and clinical research. And we're up against academic centers, and we were still able to walk away, hear from Longview, Lobo, Texas with first place in those 2 categories, so very proud. They're really why I come to work every day, just watching them grow and develop, watching them achieve what they want to achieve, their successes, their accomplishments. It's very inspirational to me, and this is why I do what I do.